lecturer of Emmanuel Augusta College of Pharmacy. Today we are going to discuss about prescribed medication order and communication skill. Prescribed medication order and communication skill. What do you mean by prescribed medication order? Prescribed medication order is the written directions which are the primary means by which prescribers communicate with the pharmacist regarding the specific treatment regimen for a patient. The prescribers may also give medication order verbally or non-verbally to a registered and licensed pharmacist or nurse. While the medications are sold only on clear, complete and designed prescriptions orders. Medication orders are needed to must have the following points: patient name of the medication, strength of medication, dosage forms, time or frequency of administration, route of administration, quantity to dispense, prescriber name and signature, refill authorizations, data, then prescribed medications order, PRN medication order should, especially the frequency of administration, maximum daily dosage and the conditions for which the medications is beginning administered. Interpenetrations of prescriptions. Drug use is a complex process and there are many drugs related changes at various levels involving prescribers, pharmacists and patients. While medications misadventure can occur anywhere in the healthcare systems from prescriber to the dispenser to administrations and finally to patients' use. While many errors can be preventable and pharmacists play an important role in the appropriate dispensing of prescribed medications. By interpenetrating the proper applications involved in the prescription, one can effectively interpenetrate the prescriptions and avoid errors. Next, the following table mentioned the interpretations of commonly used applications and Latin term while the prescribed applications and the interpretations. Application, Latin name and interpretations. And of each and before. Then applications. The next topic is legal requirements. A PRN protocol is a record for PRN medication order which are ordered on a daily regular basis. So such medication order should specify the frequency of administration, maximum daily dosage and the condition for which medications is beginning administered. The PRN protocol provides additional information regarding the medication order and to understand the pharmacist when and how much of the prescribed medication to give. The PRN protocol should include the following points. All of the information is found in the regular medication order along with the specific signs and symptoms for which the medication should be given to a patient, a maximum daily dosage, Any special instructions, for example, when to call prescribing practitioner or nurse. The next is equal to communication skill. Communication skill are the capability to use language in a precise and express information is an easy way to understand with patients and family members, other physicians, nurse, pharmacists, and other healthcare providers. Effective communication skills are a critical element for patients, pharmacists, and doctors. Following are the three main goals of communication: creating good interpersonal relationship, then facilitating the exchanging of information, including patients in decision making, interpersonal relationship, exchanging of information, patients in decisions making. There are the three main goals of the communication skills: interpersonal relationship, exchange of information, patients decision making. Then poor communication skills between pharmacist and patients may lead to the following: inaccurate patient medication history, inappropriate therapeutic decisions, leads to patient confusions, patient disintegrated, and patient non-compliance. Communicating with health professionals. Effective communication between pharmacist and physician, nurse, and other pharmacists are external. Following are some instructions and advantages of effective and clear communication between different health professionals involved in the patient care services. First one, good doctor-patient's communication has the potential to help in the regulating patients' emotions, faculties, comparisons of medical information, and allow for better identification of patients' need, precipitations, and expectations. Second one, patients report good communications is more likely to be satisfied with their health care and especially relevant information for accurate diagnosis of their problems, following the advice and adherence to the prescribed treatment. A more patient-centered communication may provide a satisfactory result from the patient as well as from the doctor. A pharmacist must notify within a responsible time after renewing the prescription. Pharmacists are periodically required to contact prescribers to manage drug interactions or suggested changes to therapy that could ensure the best possible patient outcomes. Manage the drug-related problems by providing your therapeutic recommendations to the prescriber, including how to manage these situations. Always to include a reference to the evidence that supports your recommendation. This can increase the prescriber comfort level with the future recommendation. Effective written communication to prescribers is essential to provide appropriate and comprehensive patient care, reducing the risk associated with unclear measuring promotes patient safety and quality care. Communication between prescribers and patients. Effective patient counseling can assist patients in using their medicine safety and reliability. Before giving information, check the patient's level of understanding. Advise the check the patients to adapt medication regimen to their lifestyle. Following are some type of communication required for collecting the informations and instruction with the patients by health practitioner. Medication history interview are required for making decision. The following information is required while communicating with the patients. Currently or recently prescribed medicines. OTC medicines purchased, vaccinations, alternative or traditional remedies, medicines were for patient information leaflet. Practitioners should use the following key information to help understand the patients and their tired and generic name, indication for which the medicines are being taken, dosage, administrative advice and instruction, information on the actions required to dosage is missing, common address. Common or serious side effect may occur due to the drug administration. Storage conditions for prescribed medicines information. Action to be taken if a side effect is an restriction. Action to take if a side effect is experienced. Name and contact detail of the hospital, physicians or health care provider. Name, signal. Other and data, publication of their information. Thank you. Thank you.